Hey everybody, thanks for tuning into another episode of the Earn It podcast. This episode is going to be one of those, I'm going to go back to a little bit to my roots and kind of make an episode specifically designed for those folks that are in nursing school listening to this, specifically in the beginning stages of nursing school or even pre-nursing. This is a really big one for folks that are thinking about getting into nursing, or you're doing your prerequisites, or you're just getting started in your nursing school journey like the first semester or two. There are a lot of people that go into nursing school with an idea, or even worse, with their mind made up of what kind of nurse they want to become. And so today I'm going to talk about why it's important for you to maybe not make your mind up so fast. Or if your mind is made up, how do you approach nursing education in order to get the most you can out of your career? So I'm going to start this off with a little bit of a personal story. And then I'm going to go into what sort of lesson that we might learn from this. My story, as of the time of recording this, is not yet complete. At the time of recording this, I have about 5 months left in nursing school, 1 semester. Basically, my practicum, a few papers, and studying for the NCLEX. That's what I have left. However, my decision of what kind of nursing I want to do is completely different from the nursing I thought I wanted to do when I was getting into nursing school, and even the first semester or two of nursing school. It has dramatically changed, and I am more diligent now about what kind of nursing I want to do now than I was at the beginning, and that's because of something that I did and something that I advise everyone listening to this to do themselves. You can accept the fact that you want to do something at the beginning of nursing school, and it's not wrong. There's nothing wrong with it. That's not what this is about. This isn't about don't make your mind up already. No. Make your mind up and stick to your guns. But there's a few things that you should do just in case you miss a potential life-changing, life-altering path that you never would have otherwise gone down. So back to the story. I'll try to make it as short as possible because some of you listening already know this about me, and some of you don't care, but I'll try to make it quick. When I first got into nursing school about 1.5 years ago, closer to 2 years now, right? I wanted to go into the emergency department. I wanted to do emergency nursing. I've done quite a bit of urgent care. Again, far cry from the emergency room. I understand that. I work best in fast-paced environments. I work well when I have multiple different patients. I also liked the fact that the issue that the patient is having is not exactly known, and there's something different every single patient. That probably sounds like a response to an interview question when being interviewed for the emergency department, and that's probably, if that's your answer, it's probably going to result in you not being hired in that emergency department unless they're absolutely desperate. I kind of started thinking more and more about how would I answer this interview question? The interview question of when you sit down and someone asks you, why do you want to work here? Why do you want to work in this department? Why do you want to do this kind of nursing? This is the number one question that you need to analyze from the beginning, and you need to revise your answer. There are 2 things that you need to realize. You need to think about what everyone else is going to say. What are they, and that means what are they hearing from everyone? And what is it about you that's going to stick out for this interview question? This interview question could make or break it. Now, those of you that don't have really highly kind of competitive environments after nursing school, this may not 100% apply to you in the regard of getting a job, but that's not what this podcast episode is about, getting a job. This podcast episode is about how to simultaneously have your mind made up while also keeping your mind open to other things. Again, let's continue with the story. So I started thinking about this question more and more. And then I have the ultimate answer for this interview question. And I don't mind sharing it for the emergency department, what my answer is going to be, because I have, spoiler alert, I have absolutely zero interest in working in a traditional emergency department, ever. I don't ever want to step foot in an emergency department and work again. I did have a clinical day in the emergency department, but I will get to that in a few minutes here. Being in healthcare for so long, I realize that the emergency department also consists of a lot of unique difficulties that people in an emergency department deal with that you don't really deal with in a lot of other parts. And that is a specific type of burnout that results in you being jaded. If you go to a lot of emergency departments, you'll notice that even if your problem seems really severe to you, the individual or the nurse that you're dealing with does not seem fazed by your situation, and they might seem jaded. And they might be jaded, or they could just be disciplined to remain calm. Even if you're walking in and 2 of your limbs are cut off and you're bleeding to death, they have to be completely calm. But that's not really what this is about. If you also answer, I want to do this because I'm good at being calm in difficult situations, nobody cares. You should mention it at some point, but you should mention it in giving examples of you being calm in serious situations, not saying that. You need to give real life examples. But again, I'm not trying to make this an interview tips and tricks for the emergency department. I've done a podcast episode on that. I think other podcast episodes that I've done actually talk about how much I want to work in the emergency department, and I kept some things back. But this is my answer to why you want to work into emergency department. It is, I know exactly how difficult the job is going to be. I understand that I might get done doing CPR on a 14-year-old that doesn't make it and go through a lot of trauma. And then I have to walk in the next room and get yelled, screamed at, and cussed at by somebody that 2 a.m. that has the sniffles, and they're complaining about how they've waited for 3 hours in the emergency department. Going through this over and over again wears down initial excitement. A lot of other people talking to you today, Mr. or Mrs. Interviewer, they are all really excited to come work here. And that excitement, if it's really superficial, is not going to get someone through too many of those situations before they start to experience burnout or being jaded to the point where their job performance is affected, because they don't realize how hard it's going to be. They also don't realize that they're going to deal with a lot of homicidal and suicidal people, a lot of violent people, and they may have other patients that are going to be in serious medical situations. And fluctuating between those very, very frequently is already taxing enough. But when you add in that there will also be people in there for things as minor as I stubbed my toe today and I'm 25 and really I just want to come to the emergency department because I can't go to a doctor's office about it. So you're juggling very serious situations with very not so serious situations, and very kind of new people that don't understand this going in will eventually start to wear down and their job performance will be affected. And then they will find themselves 6 months in, maybe a year tops, really not wanting to do this, but also really not wanting to leave. So then you end up with a bunch of crappy people in the department. And it's that I already realize now. And it's that I'm telling you that I am going to continue with my same performance because I am expecting all of these things. Nobody else you're going to talk to throughout this interview process really, really is expecting this. That's kind of the way I was going to go. However, I, for some reason, decided to keep this question in my mind. What am I going to say why I want to work here? What is the real reason? And the more and more you analyze that question for whatever job you want, the more you realize that you may be most of the reasons why you want to work somewhere are going to be the reasons why everyone else applying for that job wants to work there. In other words, there may not be anything special as far as why you want to work there. And that might be a good enough reason for you to maybe reevaluate. And here's how I reevaluated. I started to look at the time, what my skills were. What did I have a lot of unique, and I say unique in very big letters. What do I have unique capabilities in? And for me personally, in an urgent care setting, it was working with pediatric patients and dealing with the emotions, demands, concerns, or lack thereof with the parents. So more and more, I started to realize that I have a really good knack for this. And there was a little 6-year-old that came in at one point, and we had to do like an actual venipuncture on this kid. Nobody wanted to do it. I couldn't wait to do it. I wanted to do it because I knew what it would take. And I knew what it would take because when I first became a medical assistant, I did my clinical hours in pediatric congenital cardiology. And you cannot just have a 3 or 4 or 5 or 6-year-old walk into the doctor's office and you just walk up to them and start doing blood pressure and start doing EKGs. You have to take your time a little bit more with pediatric patients because there are a lot of extra concerns that they might have. There's just a lot of extra things that you have to do in order to make everybody, if possible, make sure that things are done where the pediatric patient you're dealing with is cooperating with you. You're not forcing anything to happen, right? So you're not forcing anything to happen, but you're getting things done and you are getting your tasks done in a timely manner, whether they are comfortable or uncomfortable for the patient. This is a skill set that I became very good at during those clinical hours and in a previous urgent care experience. This is a skill set that I personally forgot completely that I had. So at this point, I started to pay more and more attention to what are the unique skills that I have, like I said, and I think this is what you should do. Try to get into a clinical setting if you're not already in a clinical setting. Try to get in different clinical settings to see if there's a unique skill set that you have. For me, again, it was pediatrics. So I had to think about, what is it that I have a unique skill set for? And what is it that I enjoy most about performing those skill sets? Is there a certain age group? Is there a certain population? Is there a certain common disease process? Is there a certain type of injury? Really start to analyze. So I really started to analyze. Basically, you're looking for your overlap of your very unique skills that you are highly skilled at, that specifically other people that you work with do not have those skills. This is very important because this will come in handy when you're in your interview process. You're not going to sit there and basically say, well, no one else can do it but me. The point is, when you have those skills, that means that you can talk about those scenarios and you can explain what you did that other people wouldn't have done. And you don't need to say other people wouldn't have done them. Your interviewer will know that other people would not have thought to do it. That's the beautiful part about it. You explaining scenarios you've been through because you have those unique skills. If you have those unique skills, that means you have specific examples. And because you have the unique skill set that other people aren't really as good at, that means just you explaining your actions alone simultaneously explain that not only did you do that, but other people probably wouldn't have, and it was the right thing, especially if the stakes were high, the circumstances were crazy, busy, or high stress. So going back, you're finding the overlap of the unique skills that you have and what you enjoy. What do you enjoy most? And I found, funnily enough, as a guy going into nursing, that anytime somebody came in between 0 days old and like 18 months or so, maybe up to 2 years, but really 0 to 2 years, that was my favorite age group, because around the 12 to 18 month mark, you're starting to deal with patients that are being, quote unquote, being very difficult to get your tasks done. And guess what? I would go and I would do them anyway. Whether they were uncomfortable, painful, I would do them very quickly and while the patient was enjoying the situation. Now, some you just can't get them to enjoy. If you have a 16-month-old with a horrible raging ear infection and a fever and the sniffle, you're just not going to get that patient to enjoy it. But I refused to give in on atraumatic care. So in order to get a swab from a little kiddo, I'm not going to burrito blanket that kid. I'm just not going to do that. I will, and I always did find a way to do what needed to be done without doing those things, without the need for something like sedation. Now, again, when it came to doing stitches or something, you just can't have a little kiddo. Like you at a certain point, you do need something like sedation. I'm not saying providers or nurses that can't get their kids calm enough to get stitches in their face are not adequate. That is a different situation. There's my little disclaimer. I'm talking about getting a pulse ox on. I'm talking about just those simple little things. And then I thought, well, actually, the younger the kiddo is, the more fun it was for me. Who doesn't enjoy a cute little 3-month-old baby? Like, honestly, whether you're a dude or not, it doesn't matter, right? If you're a guy that's a dad, you have kids, you didn't enjoy the not having sleep part of having a kiddo, but like you get to dress them up in little outfits and they start to laugh randomly and unexpectedly, and when they smile at you, you feel like special, like this little kid. Like, it's a really weird and unique thing. And so babies. So then I'm like, okay, babies and a unique skill set with peds in general and dealing with patients and poker face. Here's the thing. In healthcare, the reason why a lot of people are anti-medicine, and then the people in medicine tend to be a little less resistant, at least, but tend to be pro things that the public are against. In my area specifically, people are against even vitamin K shots for their newborn, right? And that's fine. Everybody has their own choice. But some people can't handle that reality that work in healthcare. Because in healthcare, you have to think, we see the worst things. We see it when things go wrong, right? That's what our purview is. So let's just take a vaccine, for instance. We see whooping cough all the time, every day in certain settings. We see RSV all the time. In some cases, we see perfectly preventable meningitis infections because someone didn't get a Hib vaccine. We see those things. Other people do not. But you cannot sit there and judge parents or treat them worse, right? This requires a skill set. When you are sitting there with a child and parents, and the parent says something so off the wall to you and your point of view, that parent or set of parents should have no freaking idea that what you thought they just said was so utterly ridiculous that normally it would make you laugh. It's really, really important that you are able to separate what you see and what your beliefs are, whether they're based on evidence or not. That is completely a separate issue and not important. And that is another part of the unique skill set that I realized I had. Somebody was like, I'm really worried that they have whooping cough. Okay, well, let me look in the chart. Have they had the whooping cough vaccine? No, why would I do that? Yet they're there because they're extremely concerned about whooping cough. You can't be like, well, okay, you're sitting here concerned about it, so you obviously weren't that concerned, right? You're going down that kind of path in your head. You can't do that. And you just have to be like, all right, excellent. Are they? And then you just continue on with what you're doing like nothing happened. You're not going to sit there. It's not your job to sit there and fucking judge somebody, right? Now, the point is, you are finding an overlap. I personally found these things to be overlapped. I also found something very interesting that I didn't think I would find interesting or as interesting, which is the process of fetal development. I have a really good knack for knowing those things. Labor processes, basically labor and delivery, postpartum. This is an interesting world. You can't tell me that conception to birth is not interesting. You can't tell me that. Maybe to you it's not interesting. But the process of fetal development, I was like, that particularly is probably the single most fascinating thing to me in medicine on the planet, period. So wait a second. I love the whole process in general, right? And everything that goes into fetal development. I'm really good with babies. I'm really good with parents, and I enjoy it quite a bit. So what's going on, right? I arrive at NICU. Is this a possibility? I brush it off and say, no, this is not a possibility for me because I will be a new grad. Nobody is going to let a new grad into the NICU. It has been made very clear to me by far too many people, you will never get into the NICU as a new grad. And what they probably weren't saying in the back of their mind is, there's a reason why there aren't really men in the NICU. And you have to realize that, I'm going to preface this by saying this. I'm not a victim in any way, shape, or form. But when you're a male in a mostly female work environment, you have to expect that there are certain areas where they just aren't going to want you there because you're a male. Get over it, cry me a river, no big deal. That's fine. So not only facing the barrier of being a new graduate, so nobody's going to let you into a NICU, but also you're a dude and everybody's going to think you're weird for wanting to work with babies. Well, fuck that. Absolutely fuck that. If you think I'm weird for being a guy that wants to work in women's health and in the NICU, you can fuck yourself. That's the attitude that I have. I'm going to do it, and I'm going to go after it with every fiber in my being and make it my entire life. That is what is really important. That's not something I had about the emergency department. I didn't have, if my home hospital isn't going to let me into the ER, I will apply and I will personally drive an hour and 15 minutes one way every single day for work just so I can do what I want to do. I said to myself, if I don't get into the emergency department, I'll just go into X, Y, or Z. And then, right? But now it's, if I don't get into a NICU right away, I might go into X, Y, Z temporarily, but the entire time I am still trying to get back. At this point in time, still being a nursing student, after getting my BLS, me and a couple folks in class went and got our ACLS together. Shout out to ACLS baddies. We all went and got our ACLS together before like anybody else because we realized, we have to be very competitive. And at the time I was like, ED, but if I don't do that, I'll get into the ICU. So even when I got my ACLS, and this was about 4 months ago, I was like, that's fine. I'll go in, they're some kind of intensive care or step down unit for sure. I'm really good, really, really good at cardiac stuff.
So, but this past week, because I've done shadow shifts in the NICU, I have gotten to know the manager. I made a decision that I will put my money where my mouth is. And I went ahead and got my NRP, which is neonatal resuscitation. This is a requirement working in the NICU. But for a student, this is not something that is going to be offered to you by your hospital, and it's not something that's going to be offered to you by your school. Neonatal care, especially for preemies, is not taught in a lot of different nursing programs. In the NICU, you do things in a way that you don't do it in any other part of nursing, and the knowledge that you gain on the ground in the NICU is not knowledge that you will get anywhere else. And that's another thing that I like about it, but that also makes things a little bit more difficult. So, another $250, I now have my NRP, and I am dedicated. If I don't get the job where I'm at the hospital that I'm at, and that I know will be opening up here in like a couple weeks, I will absolutely drive an hour or longer out of the way so I can have that job. And eventually I will come knocking back on the door at my current hospital when they have a position open. It's no matter what. And here's another aspect of it. If you are not comfortable saying, look, if I have to do something else for a year, 2 years, 3 years, 5 years, but at the end of my career, I will be doing X, right? Then it's probably not for you. If you can't handle not getting it and potentially doing something else, right? But eventually getting there after years of doing something else, it's not worth it for you. It's not worth the wait for you, and you probably shouldn't go there. If I literally don't get a NICU spot anywhere, and I don't get a pediatric spot anywhere, and I have to work in my hospital or any other hospital at just some random med-surg unit for 1, 2, 3, 5 years before I end up back, if you're not willing to constantly be trying to come back, even if that's 5 years or longer later, look, if you're looking at just being a nurse for 5 years or 3 years, then you probably shouldn't get into nursing unless you have an immediate goal of obviously going to CRNA school or becoming a nurse practitioner. And so you have to be willing to do basically whatever it takes. And that includes waiting for years to do what you really want to do. If you really want to do it, then you should be willing to even wait. A lot of people are willing to do things, but a lot of people aren't willing to wait. And that has to be something that you're willing to do. So check yourself. If you're not willing to wait like 3 years before eventually circling back to what it is that you say you want to do right now, you should probably reevaluate. What could you stand? What time frame could you stand? If you don't get your dream job right out of nursing school, you need to be okay with that. But you need to be okay and stand strong enough to realize that's fine because I will eventually get there. That's the mindset. I will eventually be right where I want to be. Even if it takes 5, 10 years, it doesn't matter, right? And that is something that I found also changed in my mind. Before I started nursing school, I'm going to start in the emergency department and I'm going to work there because they have weird off-the-wall shifts whenever you want, and I'm going to go straight to nurse practitioner school. In fact, I have everything ready for my nurse practitioner school application at a university that I've had my eye on for a few years now. I have the curriculum for that DNP program printed out, and it's sitting on my refrigerator, right? Or it was sitting on my refrigerator. But I recently threw it in the garbage because I want to do this so bad. I no longer want to go to NP school. That is out of my purview. When you can sit there and say to yourself, I have all these other aspirations of one day doing it, right? And then you find something to where you're like, actually, none of that. I want to do this forever, then maybe you're on to something. If you are good with going to a certain job and working a specific unit and never advancing your career after that, now it doesn't mean you are never going to advance your career. It means you're not right now already looking at doing something beyond your next step, right? I understand being multiple steps ahead. I was there. But getting to the point where, I want to do this in nursing and I don't even want to think about anything else, that's a really good place to be. And I'm really glad that I got there. And I hope you get there as well. And I just did it by analyzing question after question after question. It's questioning yourself, questioning what's going on around you. And that's really all it took. So I know this was a longer episode. I know this was kind of a little bit more personal. Some people out there listening to this might not really care, but thank you so much for listening to another episode of the Earn It Podcast. The Earn It Podcast is on Spotify, YouTube, and Apple Podcasts. Depending on where you're listening from, follow, subscribe, comment, like, and most importantly, share. There is a link to my LinkedIn in the description of this podcast, so feel free to reach out if you have any questions or if you would like to come on and have a discussion. Again, thanks so much for listening. Go out there and earn it today.